Right this moment, millions of connections are bursting into the ether. If visualized, they might look something like this. Financial technology, or fintech, is everywhere. A buzz phrase seemingly on everyone's lips. Reimagining the future.
Really, the end game is to serve as many Africans as we can anywhere in the world.
In Uganda, a buzz phrase is seemingly on everyone's lips, and for a good reason. Fintech is Africa's modern-day gold rush, with investors betting big on startups offering services from digital banking to retail payments to neobanking and healthcare. According to TechCrunch, fintech investments had a record year in 2021, as tech startups across Africa raised close to $5 billion. And while fintech might seem like a big, complex, intangible concept, more and more people use it every day.
Fintech is a growing market in Uganda, for example, and of course, making it a hub of also accessing investment would be very key in making sure that these fintech companies, as they grow, then they can be able to provide services even better and serve Ugandans even better.
At the Ledel Garnera Maternity Center, fintech in the form of clinicPesa is used to help expectant mothers gain access to healthcare financing.
Typically what they are doing here is that they are preparing early in time to save for the cost of their antenatal visits and also the safe child delivery, as well as the birth preparedness kits and transportation to this healthcare facility from the communities around. When we look at the maternity centers, just like Lady Ganyila Maternity Center Clinic today, we have over 318 of them that we are working with to scale the clinicPesa Mamas program, and this is really transforming the journey of maternity and reducing maternity mortality.
clinicPesa is a fintech company that provides a range of healthcare financing solutions so that people can be able to pay for their healthcare and they will be able to receive full treatment without any challenges.
clinicPesa, a healthcare loans and saving platform, is trying to reach the uninsured.
We're working with a chain of over 1,800 healthcare facilities across the country in Uganda, and today we are serving over 250,000 customers.
Onyancha was inspired to launch clinicPesa after falling ill and finding himself unable to afford the medical bills.
I was in the consultancy field for quite some time, and this time around I fell sick and I'd just done my consultancy. I didn't have enough money in my account. The doctor decided to give me treatment and then I could pay later. It was a challenging time looking at a person like myself who is actually working and failing to fully pay the medical bills or access full medical treatment. When I did a bit of research, I found out that so many people were going through the same challenge, and so I made it a point to start something that could be able to tackle this same problem.
In Uganda, formal insurance services are not heavily used, and with the majority of the country's population using mobile phones to access digital technology, clinicPesa offers an alternative to formal insurance.
Why I think today it's important for youth to come up with solutions for the modern day problems is that we are the generation that can solve our own problems. We're not going to wait for anyone to come and solve these problems. If we solve the problems and close the gap, improve life for the communities we're actually living in, then it becomes very, very important that even our children and children's children will find a better environment to live in,
According to the Africa Health Agenda, medical bills force about 15 million Africans into poverty each year. Onyancha is hoping the services clinicPesa provides can help avoid that.
Today we are serving over 250,000 customers, ambitiously growing this to close by the end of the year at 1.4 million customers. We want to see households being able to receive care without any struggles. For us, that's the impact we want to achieve. So we want to see clinicPesa as a household service rather than just a service. We want to make sure that the service is beneficial to the users, to the customers. There is added value to the customers. It benefits them whenever it comes to healthcare. We want to ensure that we improve the quality of healthcare.